Zachary learned more than just social skills from working with a dog. He also improved on a basic fine motor skill he had been having trouble with for years, cutting with scissors. With even the most specialized occupational therapy scissors, Zachary still resisted the activity. He would often have a tantrum as soon as he saw the paper and scissors on the table. Audrey, his occupational therapist, would often have to do the activity with Zachary, hand over hand, in order to get him to cut a somewhat straight line. Audrey came up with the idea of bringing in dog treats that Zachary could cut. The first time Audrey models treat cutting to Zachary, it's as if a light bulb went off in his head. He still had trouble holding the scissors, but he seemed motivated to continue the activity. It was the first time Audrey didn't need to do the activity hand over hand. In just 2 weeks, Zachary graduated to regular kindergarten scissors, something Audrey had been trying to get him to use for the better part of the past year. Both therapists believe Zachary was motivated to use the scissors because he saw there was a purpose to the activity, making Henry happy, which in turn made Zachary happy. You can see the joy on his face as he feeds Henry treats. We tested out this motivation theory by having Zachary cut dog treats and then immediately hand him a piece of paper to have him cut. Notice how right after cutting the dog treats, when he sees the piece of paper, he acts as if he has no idea what to do with the scissors. Even after the therapists model how to do it, Zachary still acts unmotivated. Then we give him a dog treat to cut. And he picks up the scissors and puts his fingers in the hole without any trouble. During post-testing, Zachary surprised us all. When handed a piece of paper and scissors, Zach cut without any problem and without any help from the therapists.
I don't think he holds it that way when he's cutting. He doesn't. His fingers aren't in the. They're not in the. He wasn't holding it with me. Here's Zachary.
A few weeks after introducing Zachary to treat giving, the therapist began having him serve the treats to Henry on a tray. The purpose for the tray is to teach independence to the client. Not only does this activity offer fine motor skill exercise, but it also is teaching Zachary the basic skill of carrying, for example, a lunch tray at school or a plate of food at home. Notice how once he understands what is expected of him, he continues the activity without prompting from the therapists.